Okay, so now we're going to talk about changes in pregnancy that happen in the cardiovascular system, the hematopoietic system that's making blood, and the respiratory system. The cardiovascular system, blood volume increases to about 150% of pre-pregnancy volume. That means we have increased cardiac output, and the heart actually enlarges slightly in pregnancy. As the uterus enlarges in the third trimester, it actually displaces the heart upward and rotated to the left of it. So when you're auscultating, you're going to hear those valves in slightly different locations. Temporary murmurs are common, and it's also common to have some auscultatory splitting when you hear those valves close at slightly different times. The pulse increases by about 10 to 15 beats per minute to increase that cardiac output. So we've got bigger volume and higher pulse. We need that increased output because we have the placenta and the fetus to perfuse. Occasional dysrhythmias are not unusual in pregnancy. If they're symptomatic, they need to be evaluated. Systolic blood pressure usually doesn't change much. Diastolic actually goes down a little bit with all the expanded space for that blood to be, but it gradually increases as we actually increase the blood volume. Blood pressure needs to be measured regularly because dramatic increases in blood pressure or gradual increases in blood pressure can signal some complications that you'll learn about later. We also have peripheral vasodilation. We have hormones that cause us to vasodilate so that we get better blood flow to the placenta. Well, they dilate pretty much everything. So if I've got peripheral vasodilation, what is my risk? What am I worried about? I want to think about orthostatic hypotension, stand up, get dizzy, fall down. One last thing that happens from the second trimester onward, when someone who's pregnant is lying supine, the uterus is compressing the vena cava. And the vena cava is what takes all the blood from the lower extremities back up to circulation. So if it's being compressed, then blood gets down to the legs, but it gets trapped there because it cannot get past that vena cava. It's called vena cava syndrome, and it will cause weakness, dizziness, lightheadedness, sometimes arrhythmias. It also will cause fetal heart rate changes, if we're completely compressed, not getting enough perfusion. So we want to encourage women in later stages of pregnancy to sleep on the side. Left side actually is the best, gives the best circulation, but we want them to sleep on the side. And even in a situation where they need to be supine for some medical reason, we want to put something under the right hip, tilt them just a little bit to the left to get the heavy uterus off of the vena cava. The hematopoietic system. Because of that increased blood volume, at around 28 weeks, the hemoglobin level drops. So it's called physiologic anemia. But a lot of people who are pregnant also have a hard time getting in enough nutrients. And so they might develop symptomatic anemia because of the combination of increased need, difficulty with intake, especially in the first trimester when they're nauseated, and that increased blood volume. The white blood cell count increases, and we have increased clotting. So all of those you may notice on a CBC. The respiratory system, we need more oxygen because we're oxygenating self, but also we're oxygenating the placenta and the fetus. So we need more oxygen. The rib cage relaxes and it allows the chest to expand better because we need more oxygen, but as the uterus grows, it puts pressure on the diaphragm and makes it hard to take deep breaths. So we end up with more thoracic breathing, the rib cage relaxes, and we end up with usually a little bit increased respiratory rate. Vascular congestion of the upper respiratory system is common, especially in early pregnancy. So just a stuffy nose is pretty common. In the next section, we're going to talk about most of the rest of the body systems.